What are the possible side effects of aceclofenac? Now remember, like all medicines, aceclofenac can cause side effects, but it's not necessary that everybody gets it. So stop taking the medicine and seek medical advice immediately if you experience the side effects. Now, what side effects can you possibly get with aceclofenac? One is severe allergic reaction, that is anaphylactic shock, which I explained or mentioned earlier. And these symptoms of anaphylactic shock can develop quickly and can be life-threatening if they are not immediately treated. And I've already told you what are the main features of anaphylactic shock: difficulty in breathing, wheezing in the chest, abdominal pain, vomiting. Sometimes you can get swelling of the face and throat, and sometimes fever also. Severe skin rashes, they are called as, these are very rare, but at the same time, they are life-threatening disorders. They are called as Stevens-Johnson syndrome and toxic epidermal necrolysis. These are potentially life-threatening conditions. And if they develop quickly, forming large blisters. The skin tends to peel away. The rash can also appear in the mouth, throat, or eyes. Fever, headache, aching of joints can also occur at the same time. So one has to be very careful if you get these symptoms. Meningitis. Now, this is not an infection. This is only swelling of the coverings of the brain. The symptoms include high fever, headache, vomiting, blotchy red rashes, neck stiffness, sensitivity, and intolerance to light. Then passing of blood in the stools. Then you can have black tarry stools. The color of tar is black. So same way, the stools can also be like tar colored. Then any vomit which contains certain particles which look like coffee powder. Which I told you earlier, aceclofenac can also be associated with a small increased risk of heart attack. And finally, kidney failure. So all these side effects can develop, but as I've said, and I repeat, not in every patient taking aceclofenac. Stop taking these medicines and seek the medical advice if you experience indigestion or heartburn, abdominal pain, then certain blood disorders, which has reduced production of blood cells, abnormal breakdown of red blood cells, which is called as hemolytic anemia, etc., etc. You may feel extremely tired, breathless, aching of the joints may be present, and you may be prone to repeated infections and bruising. If you develop these side effects, or if they get serious, then also, and if you get certain side effects which are not mentioned earlier, please contact your doctor immediately. So all these things one needs to keep in mind before and during taking aceclofenac. Now, how will you store aceclofenac? First of all, keep the aceclofenac tablets, they're available in strips, out of sight and reach of small children. Do not take aspirin or aceclofenac like drugs after expiry date. The expiry date, you may be aware, it's written on the carton and the strip. Do not store aceclofenac above 30 degrees centigrade of temperature. Now, if your tablets appear to be discolored or if they show any signs of deterioration, please do not consume those tablets. If your doctor tells you to stop the tablets, please do so. And keep them, retain them only if he advises you. Do not throw away any medicines in wastewater. Now, how is aceclofenac available in the market? Aceclofenac, as I told you, is available. The active ingredient is aceclofenac, and each film-coated tablet contains 100 milligrams of aceclofenac. The tablet also contains certain other active ingredients used to bind and coat the tablet. So aceclofenac is generally available in blister strips of 10 tablets. Well, that's all I wanted to tell you about aceclofenac, and I'm sure that this information will help you to consume aceclofenac as prescribed by your doctor with a little more confidence.